There is an evil on the horizon in Summit County. An evil that has haunted mankind since the beginning of time. That evil is contaminated water. And if left unchecked, it can have devastating effects on the environment and residents of Summit County. While most men and women would back down in the fear of such danger, there are a few who decide to stand and fight. A few who look to make the world a safer place to live in. We call them the Aqua Squad. This is the Summit County Public Health Water Quality Division. And they are here to fight for a cleaner tomorrow. Not all heroes wear capes. Some just wear a polo with khaki pants.
Well, they may not be the Avengers, but the Aqua Squad is working to protect you every single day, whether you know it or not. Welcome to the first episode of Public Health is Everywhere. And I'm your host, Steve Nemechek, and every month we'll be taking a look at the different programs and services the health department has to offer. As you can tell, our first episode is going to be about water quality. To get a better idea of what the water quality program is all about, we sat down with a few sanitarians so they can explain to us what it is they do.
Water quality works to protect all the bodies of water in Summit County, whether that's groundwater, surface water, things like that. We do that by inspecting and regulating private water wells, home sewage treatment systems, and we also work with each individual township, village, and city with their stormwater sampling program. We look to minimize human contact with untreated wastewater or unsafe drinking water. There are many health effects that could come from that. People can get sick very easily from all the bacteria that could be in this water. We try to minimize their contact with that.
The general services that water quality offer are permitting of new and replacement septic systems, inspections on existing septic systems, point of sale evaluations for property transfer, permitting of new and replacement private water systems, and stormwater sampling. As a homeowner, maintaining your septic system is important. Not only are we trying to prevent the public from getting sick, we're also trying to prevent you from spending the money to replace a septic system. So if you do little things throughout the years, it's going to stop you from spending a lot of money to replace your system. At some point, your septic system will fail. No septic system lasts forever, unfortunately, and you will have to replace, but you can make the system last much longer by taking care of it and maintaining it. 3 things I think it's important to share with homeowners in Summit County with a septic system are, the first is don't overload your commode. When you have a septic system and a private water system, it's really important to space out your water usage. So when you're doing dishes, don't keep the water running the whole time. And when it's time to do laundry, don't wait until Sunday and do 7 loads all in one day. Spread those loads out over the week. It's a lot of water that you're pushing through your system at one time. And same with if you have footer drains routed into your septic system, it's a good idea to route those elsewhere, because that is also excess water that your system has to take on and treat. Although it is just rainwater, it's still water that has to be pushed through the system. Another important thing is to think at the sink. We always recommend against additives. They actually harm your system more than they can benefit them. The way septic system additives work are they break down all of the solids in your septic tank to prevent you from pumping as often as you should, but then once that liquid carries through to the treatment component in your system, it actually solidifies and can clog up your system and harm it. So it's really important to think at the sink and not add any additives into the system that shouldn't go in there. Another thing that's important is to shield your field. So we always recommend against driving over the area of the septic system, whether it be the tanks or the treatment component. If it's a filter bed or a tile field, that excess weight on the system can really harm it and can actually cause a tank to collapse if there's too much weight. It's also important to not build in the area of your septic system. So if you are looking to build a pole barn or a shed or something like that, that's why we have the program at the health department called Building and Zoning Approvals. So if you are interested in building a pole barn or a shed or an addition on your home, we ask that you get approval through us first, just to make sure that you are not going to infringe on your current septic system and harm the functionality of it. So it's really important to shield your field.
Now that Nate and Jess have given us an idea about what the water quality program is all about, let's take a look at what it's like to be a water quality sanitarian out in the field. Joining us today to talk about what it's like in the field as a water quality sanitarian is Craig Davis. Craig, how's it going?
Hey, pretty good, Steve.
Specifically today we're going to be talking about stormwater. Can you tell us a little bit more about the stormwater program here at the health department?
Sure. So the stormwater program, at the end of the day, what we're trying to do is try to find illicit discharges that might be contaminating the waters of the state and be potential sources that could be a public health hazard. The way that we do this is after about 3 days of no rain, the idea is that it's been so dry that there should be no more flowing stormwater going into the outfalls. And if there is something flowing through these outfalls, then that's a red flag for us. So we're going to collect a sample for further analysis to see if maybe this potentially is an illicit discharge or a contamination issue that we need to look into further.
So when you're collecting these samples, what is it exactly that you're looking for? What's a good indicator that something may be wrong with the water?
So with the samples we collect, we analyze them back at our lab, and we're testing specifically for a high level of E. coli. E. coli is the bacteria that we look for to indicate that there's wastewater in the waterways. There's a certain threshold and an allowable amount from just natural things that would maybe create E. coli or discharging septic systems that meet EPA standards. But anything above that threshold, especially very high amounts of E. coli, is an obvious contamination and public health nuisance going on, which will require us to investigate even further to figure out maybe where it's coming from.
So how about you take us to one of these outfalls and show us how you collect the sample?
All right, sounds good.
Here we are in one of the local community areas in Summit County, and Craig is going to show us how to take a sample from an outfall.
All right, so as you can see in the outfall here, we've got a pretty steady flow of water. Since it hasn't rained for 72 hours, and there is water flowing there, we want to collect a sample just to make sure that it isn't a high E. coli positive sample and that it's not an illicit discharge, and what's coming out of there is in fact clear, clean, acceptable water that isn't polluting the waters of the state. In order to do so, I have a tool here called the dipper. And this dipper is used to sample outfalls just like this one that might not be easily accessible without that extra extension on there. You just fill the dipper up as much as possible. And then I've got my sample bottle here. And you want to slowly pour from the dipper into the sample bottle. Fill it up. To make sure that it's full enough, there's a little line on the bottle. That's the 100 milliliter level mark. And you want to make sure that there's enough water in there to be above that mark, so when we take it back to the lab, they have enough to work with that they can get a proper analysis to see if the level of E. coli is high, or if the water that we coming out of here in fact, is good to go and isn't contaminating the waters of the state. And then after collecting the bottle, take it and put it in a sample cooler. Make sure it's labeled and has a lab slip, and then we'll take it back to the lab for analysis.
So we're back here at the Summit County Health Department in the lab, and I'm here with Jeff Keenan, a water quality sanitarian. Jeff, tell us, how long have you been with the health department, and what is your job title?
I've been with the health department for just over 2 years now. I'm a sanitarian. I also work part-time, and I'm certified by the EPA to do our lab testing here.
Okay, so try to explain to us when some of the water quality sanitarians bring back samples, what exactly is the process? Like, how long does it take for them to get the results back, and how does it all work?
Yeah, so upon receipt of their samples, we have to analyze them within 30 hours. So we always make sure we try and stay safe of it. Usually about 24 hours or less, we'll analyze the samples. From there, we add our growing media, which is Colisher here. And then from there, we'll add it into a Quantatray, and we'll seal it up, and then we'll incubate it for 24 to 48 hours. And then from there, the sample results can be ready after 24, but sometimes have to wait to 48.
We actually got Craig's sample back, so if you could take a minute and show us what it looks like and what the results show.
Yeah. So with every set of samples, you're required to do a positive and negative control. My positive is still in the incubator, but my negative control is here. This yellow indicates that there's no contamination of anything. The yellow is the color of the growing media, so it stayed negative for everything. Here's Craig's sample. The purple indicates the total coliform bacteria, which is just an indicator bacteria, which is used more in drinking water, not necessarily for stormwater. We use E. coli testing for stormwater, so E. coli will fluoresce. So underneath the light, you'll be able to see all the wells that are fluorescing are E. coli positive wells. So this one has a large amount of wells that are E. coli positive. So with that, it will become an unacceptable sample.
So now that we know the results of Craig's water sample, what's the next step?
So the next step would be to give the area sanitarian or Craig the result, and from there we'll start with the source tracking of the illicit discharge. The first step of that is going upstream from the outfall and trying to find where there could be any potential contamination. One of the big parts of source tracking is using tracing dye, which we would add neon green, for instance, tracing dye into a septic system, run some water to push water through the system and see if it discharges out to the road or the stormwater retention system. And with that, if it does, we'll try and follow it all the way down, and the dye will actually show up at the outfall.
So as it turns out, the sample we collected from this outfall was high for E. coli, which prompted us to do a further investigation. So what we did was we went upstream and we looked at the septic systems, and we found one that looked a little off. So we used something called dye testing on that septic system to see if it in fact was contributing to the high E. coli count from this outfall. What I have in my hand here is a bottle of the tracer dye that we use for dye testing. You can see there's a sticker here, yellow-green. That's what the actual color of the dye that we put in the septic system is going to look like. When we put it into the septic system, we then discovered it coming out into a catch basin near the septic system and then making its way all the way down here to this outfall, which tells us that that system is contributing at least to this illicit discharge and might be the potential main source of the problem altogether. So now we can address that septic system, hopefully resolving the issue once and for all.
And that concludes our episode of Public Health is Everywhere. If you would like more information on the water quality program or our other services, visit our website at scph.org.